Hello, everyone. Good evening. My name is Ken, and let me take this opportunity to introduce you to our episode today. And today we are going to discuss about TB. And TB is an abbreviated word for tuberculosis, and in Kiswahili they call it kifua kikuu. And I'll start by defining for you what TB means. So TB or tuberculosis is an infectious disease that primarily affects your lungs and can also affect other parts of the body. The bacteria that is responsible for causing TB is called Mycobacterium tuberculosis. Now, when I was divining about TB, I mentioned that it is a disease that is primarily affecting your lungs and can also affect the other parts of the body. That means we have two classification of TB. Number one is pulmonary TB. Pulmonary TB means it is affecting your lungs. Number two, it is extrapulmonary TB. That means it is the TB that affects other parts of the body or organs now apart from the lungs. Example of extrapulmonary TB, we have TB meningitis, that is the TB that affects your brain. Number two, we have TB abdomen, or sometimes they say TB peritonitis. Number three, we have TB of the bones or TB spine. And then we have TB adenitis. So those are the forms of TB that falls under extrapulmonary TB. Now, let's talk about the signs and symptoms of TB. And when we say signs and symptoms of TB, signs are the things that you see in a patient. Symptoms are the things that patient will tell you when they visit your facility. So signs and symptoms of TB include one is cough. And cough, in this case, we mean a cough of any duration. And there is chest pain or chest tightness. Number three, we have loss of or unexplained loss of weight. We have anorexia. We have night sweats. We have loss of appetite. Um, we have low grade fever. Those are some of the signs and symptoms of TB. Now, any patient who present to the facility or who present to the outpatient department with the signs and symptoms that we have mentioned, like now the cough, that patient is declared as a presumptive patient, or that patient qualifies to be done screening for TB. I know your first impression will be upper respiratory tract infection, or maybe after doing your examination of the chest, maybe you will make an impression of pneumonia depending on your findings. But now keep in your mind that this is a patient who has presented with signs and symptoms of TB. And don't be in a hurry to start this patient on these common antibiotics. It is good you screen for TB because they are presumptive. And presumptive means they have presented the signs and symptoms of TB. As much as you want to treat this patient for upper respiratory tract infection or pneumonia, can you also rule out TB by doing the investigation? Now, when we talk about the investigations of TB, according to the WHO current guidelines, the sputum gene expert or the gene expert is the first recommended test for TB. Gene expert is a molecular test that you use the sputum in detecting TB. And Gene Expert is a new test that was actually found recently, and not like in the past where people used to do microscopy and the chest X-ray as the first test. Nowadays, there is Gene Expert, which is a molecular test for detecting TB, and it's a test that takes about 3 hours, and it has high sensitivity and specificity, and that's the test that the WHO or World Health Organization actually recommend to be done as the first test. Number two is we have the chest X-ray. Now, the chest X-ray actually is it's an imaging done on your chest, and it's actually helping us to see how the lung feels looks like, and if there is any features of TB. Number two or number three, we have other tests like now ESR, and then also we have the microscopy. And for microscopy, we don't rely so much nowadays. Initially, we used to do microscopy as the first test, but nowadays it is used for monitoring patients during treatment. Like now, you've sent a patient for sputum gene expert, and the results now comes positive. You start the patient on treatment after the first 2 months. Remember, we are treating this condition or this TB for 6 months. So for the first 2 months, uh, if the results of the patient is positive now for gene expert, you start the treatment. After 2 months, you need to make follow-up for that patient by now using the microscopy, sputum microscopy, to monitor to monitor the patient during the treatment. That is the month 2, 3, 4, and 5 until they complete their course of treatment. Now, the other test is the HIV status. The HIV status. The HIV status in this case, it is actually helping you to investigate around your diagnosis or your impression, because a patient will come complaining of a cough for more than 2 weeks, and maybe they're having general body weakness. So you are trying to investigate what could be making this patient to have a low immunity, which is actually making him or her to be at risk of getting diseases like now what we are talking about, that is TB. So HIV test is very important. Another test also is the random blood sugars. And any patient with a terminal illness like cancer, like hypertension, like diabetes, or maybe a seroreactive patient or a HIV positive patient, they have low immunity. And now, and when you do the random blood sugars, it is very important, because if they are diabetic, that means their immunity is low and they are at risk of getting TB. So those are the tests that will help you to investigate around. There are some other tests like now ESR, or erythrocyte sedimentation rate. The normal ESR is 0 to 10, or around 10, 0 to 10 or 0 to 20. So sometimes when you do ESR for a patient who is presumptive, sometimes you get the ESR is actually high. It's more than 100. That shows there is a lot of inflammation in your body, or there is a condition actually that is causing illness in your body, and that's why the ESR is actually going above, extremely above the normal. Now, after doing that, after doing those tests for your patient, it is now time to make your diagnosis. Now, and in diagnosis, diagnosis actually they are divided into two. There is bacteriological diagnosis, and there is clinical diagnosis. Bacteriological diagnosis means a patient has come and presented the signs and symptoms of TB, and you've taken the sputum from the patient, you've sent for a gene expert, and the results now come positive. So that is bacteriological diagnosis. The gene expert results is positive for Mycobacterium tuberculosis. So that is one. Number two is a clinical diagnosis. Some of our patient, they come to our facility, they complain of a cough. Many a times they complain of a dry cough, and sometimes it is hard to do sputum gene expert, and that means you are going to rely on the other test, like now the chest x-ray. And maybe after doing the chest x-ray, you realize that the patient is having a suggestive x-ray or having features of TB, but now you cannot do sputum gene expert because the patient is not able to produce sputum. So you can still make diagnosis of TB by using a chest x-ray findings, and then you start the patient on treatment. So when you start the patient on treatment, you also follow up for sputum. Can you push, make sure they produce sputum so that you don't just use the chest X-ray as the tool for diagnosing that patient. You are allowed to start the treatment, but now make follow up. Make sure that when they start the treatment, make sure that you follow the sputum for now GeneXpert. At least it is very helpful now, so that if it is positive, at least you can even do what we call the contact tracing, because you sometimes it's hard to do what we call the contact tracing, or looking at or also screening the other members of the family if they have the same, now by just doing a chest X-ray. So if the sputum GeneXpert is positive, it now tells you that you need to do more, or you do contact tracing. Now that is part of the diagnosis. It is bacteriological diagnosis and clinical diagnosis. So let's go to the treatment part of it. Now, after diagnosing your patient to be having TB, you've make diagnosis of TB. Now, either through bacteriological confirmation or through clinical diagnosis. TB is actually uh, you treat for 6 months. The first 2 months is you start with the treatment for 2 months. Then after 2 months, for those who are bacteriologically confirmed, you follow up with by doing microscopy. Now, so after 2 months, you do the microscopy to check if they have converted to negative. Now, before continuing with the continuation phase, for those who are clinically diagnosed now based on the chest X-ray finding, after if you are not successful getting the sample for GeneXpert for those patients, after the 2 months, you just continue with the 4 months treatment. And in this case, there are medication for TB actually. I'm almost forgetting to say about it. There is combined medication, that is the anti-TBs. And the first 2 months, you use the combination of 4 medication, that is rifampicin, isoniazid, pyrazinamide, and ethambutol for the first 2 months. When they have finished the first 2 months, it is now time you do the follow-up, or you do the sputum microscopy to check if they have converted to negative. And if they have already converted to negative, then you continue with the continuation phase, now using a combination of rifampicin and isoniazid, that is RH. Now, the treatment for pulmonary TB is going for 6 months. That is the first 2 months of rifampicin, isoniazid, pyrazinamide, and ethambutol, and then you continue for 4 months with rifampicin and isoniazid. For the patients who are having TB meningitis, TB of the bones, you treat them for 1 year. That is, you do the first 2 months with the rifampicin, isoniazid, pyrazinamide, and ethambutol, and then after 2 months, you now go to continuation phase for 10 months. That is for TB meningitis and TB of the bones. That is under the extrapulmonary TB. The treatment actually is prolonged so that the Mycobacterium tuberculosis is cleared in the body. So let's look at the risk factors as the risk factors as for TB, tuberculosis, or people who are at risk of developing TB. One is people who are drug abusers or alcoholism. Many patients actually who have TB, if you are actually very keen during your when you are taking your history, you will realize that many of them are drug abusers. They are alcoholic, and so that is one of the risk factor. Number two is extreme ages. Extreme age means very young, they are very young, and the old, and it's because of the immunity. For the young ones, the immunity is low, and for the elderly patient, actually the immunity tend to go down, and they are at risk of getting these diseases. Another one is patients with terminal illness like the cancer, and we have diabetes, and then we have hypertension. Those are the terminal illness, or those are the conditions actually that lowers your immunity, and you are at risk of getting TB very fast, because now your body cannot defend, or does not have that capability of fighting the infection. Now, how do you prevent TB? Number one, prevention number one. Let's start with the immunization. The routine or immunization that we do to our kids, it's called the PCG. PCG is the immunization that is done to our kids actually to prevent TB. You can read about it. I don't want to explain more about PCG. Many people actually, or many children, many kids are being taken to child welfare clinic for immunization, and it's good to know that PCG is specifically for TB, to prevent TB. Number two is avoiding crowd. Don't be in a place with so many people and you don't know their status. So avoiding a crowd actually can help to prevent TB. Number three is wearing your mask every time, especially for the healthcare workers. When you are working in the facility, it is always good to put on your mask, because the patient you are attending to, you don't know their status. Some of them, they have TB. So every time they are coughing everywhere, and if you don't have your mask, can you imagine you are attending more than 100 patients every day in the facility, and I'm very sure a good number of them actually they are having signs and symptoms of TB. And now, because they have not been confirmed, don't assume that now they are coughing. It's just because of the normal conditions like now upper respiratory tract infection or pneumonia. You just assume. Make sure that you wear your mask. That is one of the measures actually that help you to prevent this condition. And I think those are the very few things actually, or measures that help us to prevent this condition. And so in conclusion, I really want to appreciate the non-governmental organization that they have been really helping our clients in many hospitals. Example, we have the AMREF, we have the RISOC, or the Respiratory Society of Kenya, that they have been actually working around the clock to make sure that our clients, especially those who come from a low economic status, or those clients actually who cannot afford some of the tests, like now sometimes we even send for chest X-ray, and some of the patients they cannot even afford to do the chest X-ray, so they go away, and some of them even they have TB. So we must appreciate the effort by the AMREF and the Respiratory Society of Kenya for your support. We really appreciate you guys, and we pray that God will give you, will actually support you, and in helping our clients who are from low economic status. So if you are a healthcare provider, I know many people actually maybe they have little knowledge about TB, or maybe even you are a patient and you would like to ask a question, or maybe you have a concern, or maybe you have a relative with TB. Feel free to ask the question, uh, uh, anything that you want to know, and also make sure that you follow me. Uh, follow me in my YouTube channel. Um, my names are under the screen down there. So feel free to ask me any question, um, comment, subscribe, and we are going to move forward together. So thank you so much and have a lovely night. Thank you.